Hello, commissioners and attendees of today's meeting. I'm Dr. Melissa Eshelman. I'm a psychiatrist here in Austin. I was asked to provide a brief presentation on personality disorders. That includes talking about what the different personality disorders are, symptoms, treatment, and prognosis. All right, we'll go ahead and get started with that information. What are personality disorders? These are long-term, enduring patterns of behavior and inner experiences that differ significantly from what is expected in individuals in their culture. Personality disorders affect at least two of these areas: the way one person thinks about themselves or others, the way they respond emotionally, the way of relating to other people, and then ways of controlling one's own behavior. Now, what is the cause of personality disorders? A person may develop a personality disorder because of inherited genetics, as well as environmental influences. So think about temperament. Temperament is what lays a framework for an individual's personality development. Temperament is an inherited and innate characteristic that really contributes to someone's development of personality. So, for example, just think of young children. You're going to see some who are very outgoing and some that are shy and reserved, and that's part of their personality development. Temperament is also shaped through environmental factors. This includes different life experiences, such as trauma, which can include abuse or bullying, relationships and outcomes of relationships, especially those that are fractured or really diminish their feelings of trust, and then socioeconomic conditions such as poverty. And we typically don't diagnose anyone under the age of 18 with a personality disorder because their personalities are still developing. Now, prevalence, so how frequently are we seeing this in the population? I'm going to show you two studies. This first one is the National Comorbidity Study replication, which looked at data from 2001 to 2003. And they showed that for US adults ages 18 and older, there was a prevalence of 9.1%. And then for borderline personality disorder, 1.4%. So we have a study showing 9.1%, but then another study around the same time frame, 2001, 2002. This was an NIH study that showed it was closer to 15%, so 14.8%. This particular study didn't look at borderline personality disorder, but did show a higher prevalence for obsessive compulsive personality disorder. So in our DSM, there are 10 personality disorders, and they're categorized into three broad clusters: Cluster A, Cluster B, and Cluster C. And I'm going to give you some more information about each of those personality disorders. So in Cluster A, the way we remember it is that these are behaviors that seem unusual, weird, odd, eccentric. There is a genetic association with schizophrenia, not that these individuals will become schizophrenic, but they may have a family history of schizophrenia. So the three personality disorders under cluster A is paranoid personality disorder, schizoid personality disorder, and schizotypal personality disorder. So just briefly, paranoid personality disorder is as it sounds, an excessive distrust and suspiciousness. And these individuals may think others are lying to them or manipulating them, even when there's really no evidence this is happening. The second is schizoid personality disorder. And these are the really odd individuals who are voluntarily withdrawing from social interactions, and they're actually not worried about it. They're actually content being on their own. They're actually more uncomfortable when they have to relate with others. Other individuals may see these persons as aloof, detached, cold, or loner. And then schizotypal personality disorder. These are eccentric, odd beliefs, magical thinking, and they may have very few close relationships outside of just their own family members. So that's cluster A. Cluster B, this is probably the more familiar of the personality disorders. And I'm going to name out antisocial and borderline personality disorder. So these are behaviors that are impulsive, emotional, dramatic, or erratic. There is a genetic association with mood disorders and substance abuse. These individuals may have that, or they have a family history of other individuals in their family having these disorders. Antisocial personality disorder. These the behaviors are that this individual acts without a regard to right or wrong, or without even thinking about consequences of their actions and how it might affect other people. Borderline personality disorder. These are individuals who have extreme trouble controlling their emotions. They tend to be quite impulsive. They have very unstable relationship with others. There may be this extreme fear of abandonment, and they may engage in self-injury and have suicidal ideation. Histrionic personality disorder. These are individuals with excessive emotionality and are attention seeking. They really feel a need for others to notice them and reassure them that they're actually significant. And then narcissistic personality disorder is that these individuals feel a sense of importance and power, a need for admiration, a sense of entitlement, but there can also be some feelings of low self-esteem underneath all that bravado. So that's cluster B. Cluster C personality disorders, some symptoms. These are behaviors associated with worry, anxiety, and fear. And there is a genetic association with anxiety disorders. So the three under cluster C are avoidant personality disorder, dependent personality disorder, and obsessive compulsive personality disorder. In avoidant personality disorder, these are individuals that avoid social interactions and close interpersonal relations. They're hypersensitive to rejections. There's lots of feelings of inadequacy. And unlike schizoid, who are loners, these may avoid, but they really long and desire to have relationships. Dependent personality disorder. These individuals lack confidence in themselves and their abilities. They tend to be very submissive and clingy and have an excessive need to be taken care of. An obsessive compulsive personality disorder. These individuals have an excessive concern with perfectionism and hard work. And that's really to the detriment of close personal relationships. There's an over preoccupation with order, perfectionism, and much control. Now, comorbidity speaks to coexisting mental health issues, and just showing you some data from the National Comorbidity Study, and again, this is from 2001 to 2003. A large proportion of people who have personality disorders also have one or sometimes even more mental health disorders. And then this also shows borderline personality disorder, and they also have high comorbidity with anxiety, mood disorders, impulse disorders, and substance use disorders. What are the reasons these individuals might seek out treatment? Oftentimes, it's really at the request of someone else in their life, a relative or a friend, because their maladaptive behaviors are creating stress in their relationship. And actually, the individual with a personality disorder may not really be experiencing any internal distress. However, they might seek out treatment because of those comorbid conditions, depression, anxiety, sometimes their impulsivity, sometimes your substance use. And then they might seek out treatment because they're seeing impairments as a result of their personality disorder, which can include difficulties in their relationships, not doing well academically, not doing well in the job. Treatment. What treatment is available for personality disorders? Some commonly used types of psychotherapy include dialectical behavior therapy, and that really is skills-based therapy to help replace some of the maladaptive behaviors. Cognitive behavioral therapy, which looks at how your different thoughts affect your behaviors, and so how do you change some of that thinking? Group therapy, learning from others who have the disorder, and particularly those who have overcome some of the difficulties associated with their disorder, and psychoeducation, which teaches both the individual with the personality disorder and their family members about the diagnosis, treatment, and ways to cope. With respect to medications, there are no medications specifically used to treat personality disorders. However, in some cases, things like antidepressants, anti-anxiety medications, and mood stabilizing medication may be very helpful in treating some of the comorbid depression, anxiety, and impulsivity. This I found interesting. It's from, again, the National Comorbidity Study. Only, just over a third of respondents received treatment. And for borderline personality disorder, only 42% received treatment sometime in the past year. So these are disorders that can be helped with treatment that are getting undertreated. Prognosis. I'm going to just speak to the two that you can see potentially see more of within the judicial system. Borderline personality disorder actually has a fair prognosis. Studies show this improves more than expected. Psychosocial functioning can remain impaired to some degree, and there's been different meta-analysis with 5 and up to 15-year follow-up periods, which showed remission rates of 60%. Antisocial personality disorder. Typically, it persists. However, some patients can achieve remission. The mean age of getting remission is 35, so tends to be younger than someone in their 50s and 60s. Remission is predicted by less baseline symptoms. And again, that speaks to addressing it earlier, older age of presentation, improved community ties, if they're married, if they have a job stability, those all lead to better improved outcomes. So the focus of treatment, you really want to address the comorbid symptoms. You want to reduce the interpersonal conflict, stabilize their functioning, and establishing treatment early. Think of those who may not have a well-entrenched personality disorder and they're still young. That's where you really want to make sure you're addressing it. So here are the takeaways I offer to you today. Personality disorders are long-term, enduring patterns of behavior and inner experiences. So you don't quickly make the diagnosis. It's got to be present and not changing. Number two, a person can develop a personality disorder because of inherited genetics. And I think what's really important is those environmental influences. You can take that same individual and not expose them to the same dire environmental influences, and they may not develop that personality disorder. A large proportion of individuals with personality disorders have one or more other mental disorders like depression, anxiety, substance use. They may also have a sequelae of trauma. And then personality disorders are treatable, especially when treated early in the course, and very much worthy of treatment and resources. I include some references that is available. And then I also want to thank you for allowing me this opportunity. Here is my contact information. Happy to provide any answers to any questions. Thank you.